I'm Matt Galsky. I'm a medical oncologist and an associate professor of medicine at Mount Sinai School of Medicine. My main clinical and research interests are in prostate cancer, and we're exploring a number of clinical trials to develop better therapies for the treatment of men with advanced prostate cancer. One of our interests is determining whether or not drugs that we use for prostate cancer have the same effects in different populations, and we're particularly interested in studying this issue in African American men. African American men have a higher incidence of prostate cancer. The disease is diagnosed more commonly, but they're also more likely to be diagnosed at the time when the disease is advanced, and more likely to die of the disease as well. And there's a number of potential reasons for those disparities, and those reasons include things like access to medical care, but might also have to do with the underlying biology of those prostate cancers. Most of the treatments that we use to treat men with advanced prostate cancer include medicines that work on hormonal signaling in the body. These medicines commonly lower the testosterone levels in the body or disrupt the way that testosterone signals in the body. Most of the medicines that we use are based on clinical trials that have been done in the past that have shown benefit in men with prostate cancer. But unfortunately, clinical trials largely include white men, and there's been an underrepresentation of African American men on clinical trials in general, and particularly in clinical trials exploring treatments for prostate cancer. So we use treatments based on clinical trials, but we're really doing that assuming that these medicines work the same way in all patient populations. Currently, we have a study evaluating a drug called abiraterone for the treatment of men with advanced prostate cancer. Abiraterone decreases the synthesis of hormones in prostate cancer tumors and in the adrenal glands in the body of men. And by doing that, it has the potential to shrink prostate cancers, delay their progression, and ultimately prolong life, and that's been shown in a few large randomized trials. But again, these trials were largely comprised of white men, and to determine whether or not this drug works the same way in African American men, we really need to study it in an African American population, and that's the goal of our clinical trial. This trial enrolls only men, only African American men. All men get the treatment, get the abiraterone, and we're interested in looking at the effects of the treatment on the prostate cancer, and also determining whether or not there are particular genes that impact the way that the treatment works.